Hello, my name is Tara Holcomb, and I'm a Master of Social Work student at the University of Missouri-Columbia. My advocacy project is about the lack of transportation choices and the lack of awareness about transportation choices for the disability community in the Springfield, Missouri metro area. In the Springfield, Missouri metropolitan area, individuals with disabilities face significant challenges in accessing transportation. This presentation will discuss if it is truly a lack of providers or a lack of awareness of providers. I will also tell you about the Springfield metro area, the transportation providers already in existence, an organizational assessment of two of those providers, and then my proposed intervention to this problem. Springfield is the third largest city in Missouri, after St. Louis and Kansas City. The Springfield metro area comprises 5 counties: Greene, Christian, Webster, Polk, and Dallas. Although the city of Springfield only has 169,000 people, the metro area consists of 487,061 people, and 10% of that population has one or more disabilities. A disability is a condition that impairs individuals from fully interacting with the community. Examples include impairments in vision, hearing, movement, communication, thinking and remembering, and making and keeping social relationships. Many people who live in the surrounding communities rely on Springfield for employment, medical care, social events, and community activities. As a result, transportation from these areas is essential. Transportation in and around the Springfield metro area for those with disabilities is difficult to navigate, but it was much worse before the passage of the Americans with Disabilities Act in 1990. In 1998, a complaint was filed that Springfield's facilities and services were not accessible to disabled people. The city officials quickly reacted and developed a plan to remove barriers by planning more ramps, sidewalks, and accessible buses in city buildings. The city continues to improve and promises to become more disability friendly every year until 2036. While efforts are being made to address this, individuals with disabilities are still encountering difficulties in navigating the current system. Additionally, they face challenges finding ways to travel to the Springfield metro area from surrounding areas. Transportation barriers in Springfield area pose significant challenges for individuals with disabilities, hindering their ability to access employment, education, medical appointments, and social activities. Addressing this issue is crucial to improving the quality of life and independence of people with disabilities in the Springfield metro area. There are 3 underlying factors that restrict quality transportation for those with disabilities. One factor is that the Springfield metro area is expansive, and citizens with disabilities are located throughout the 5-county region, making it hard to centralize transportation for everyone. Persons with intellectual disabilities also may require additional assistance with coordinating transportation, paperwork, and ride companions to guarantee that they make it to their destination. Another factor to the lack of transportation is that there is not enough money spent on public transportation in the state of Missouri. Missouri spends less on transportation than 46 other states. In comparison, Illinois spends over 1,000 times more per capita, and Missouri spends only 11% of what Kansas and Nebraska spend. Although local solutions may be effective, it is crucial to increase state expenditures for quality transportation. Lastly, because most providers tend to focus solely on their own services, it makes it difficult for people with disabilities to locate all the available transportation options in one place. As a result, such individuals might feel overwhelmed and discouraged, thinking that there are no transportation providers that can offer the required assistance and support they need. Transportation is more than just a means of getting from one place to another. It also plays a crucial role in enabling individuals with disabilities to be contributing members of society. Locally, roughly 1/3 of Springfield's workforce commutes into the city every day, which includes people with disabilities. The 2 counties that comprise most of Springfield metro region have approximately 60,000 people with some form of physical or mental disability. On a national level, persons with disabilities have unemployment rates double that of non-disabled persons, and the lack of accessible transportation options can also prevent a large percentage of a community's workforce from reaching their workplace, hindering economic growth. If barriers to transportation were removed, 4.41 million more individuals with disabilities could find employment, gaining 160 billion in wages and earnings, thus contributing to 36 billion more federal tax revenue. During my interview with Kara Coots, she told me about her daughter Kelsey. Kelsey is 30 and has cerebral palsy and autism spectrum disorder. She found the city bus to be very confusing, and she needed multiple transfers to get to her destination and back home. Kara stated that for a person with autism or other cognitive disability, it created a lot of anxiety. So if they have a lot of anxiety just to get to where they need to go, then are they going to be focused and ready to work when they get there? Or are they going to have a sensory overload and not be able to go to class once they get there? JR, an individual on the autism spectrum, shared a couple of stories with me about his experience on the city bus. Since he resides outside the city limits, he has had to rely on a family member to take him within the city so that he could use the city bus. He also expressed his frustration about his attempts to use his disability pass on the bus, as he found it difficult to prove that he was actually disabled. Susie Irvin, an occupational therapist, noticed that her non-driving clients did not have transportation. It prohibited them from finding employment and making social connections. She realized that the bus system did not work for the population that she worked for, which was predominantly those with brain injuries. She and her brother then started Ability Transportation to help their patients. These interviews cemented the idea that for people with disabilities, gaining access to transportation impacts their overall well-being and is a significant obstacle that prevents them from fully participating in community activities. For most individuals with disabilities who need transportation, there are primarily 4 or 5 options in the Springfield area. The CU City Bus, including their Access Bus, Oates Transit, ride shares like Uber, Lyft, and Yellow Cab, Ability Transportation, and lastly, Family and Friends. Unfortunately, the city bus has a limited service area and is difficult to understand, especially for those with mental disabilities. It only travels within the city limits, so many who commute to Springfield from surrounding areas cannot use it. Ability Transportation optimistically is the best option, but they need more vehicles and drivers, and it's mostly used for Medicaid-funded appointments. CU Access is the CU door-to-door service. They have introduced this transport service for those who qualify with a disability. Riders must be pre-approved by filling out an application, thus proving they cannot use the fixed route bus system. Speaking with both Kara and Susie, they said that they only knew of one person who had qualified, and that person used a wheelchair. Unfortunately, those with communication and thinking disorders have not qualified as of yet. The Oates Transit service is very beneficial, but is limited by number and reason for need. You also have to plan ahead of time. You have to tell them 2 days in advance. Rideshares like Uber and Lyft services are instrumental but can be very costly. Lastly, Family and Friends are instrumental in providing transportation, but it is dependent on their availability, and it takes away a person's independence when they must rely on family to take them to their work and appointments all the time. 2 organizations that are making large contributions to providing rides to those with disabilities are Ability Transportation and Oates Transit. Other than ride shares, which are very costly, these 2 organizations are the only ones that can be called to transport from outside city limits into the Springfield Metro Area. Ability Transportation founder Susie Irwin said she and her brother started Ability Transportation to help their own patients. She mostly transports clients in rural areas who do not drive and cannot navigate other options. She is continually trying to find funding for more drivers and more vehicles to help transport those with disabilities who request rides from her company. Her company is funded through donations and by billing Medicaid. She is currently trying to get nonprofit status so that donations can be tax deductible. She also is a vocal spokesperson for the disability community and the need for them to have reliable transportation to be able to get to and from appointments. She has even transported individuals from their home outside city limits to the nearest bus stop so that they can take the city bus. Oats Transit is a nonprofit 501c3 organization with an annual budget of $32.2 million. Oats Transit services are funded through grants from the Federal Transit Administration, Medicaid billing, the Department of Mental Health, the Area Agency on Aging, and a mixture of state funding, donations, and rider fares. Oats Transit is the largest and most unique rural transportation system in the United States. It provides rides to elders, those with disabilities, and rural citizens. Riders have low fares that are subsidized by the grants Oats receives. Those with disabilities can speak with their Department of Mental Health caseworker and have the fare covered. According to multiple sources in the community, the Oats bus frequently cannot give rides to all those who desire the service. Therefore, they prioritize those getting to and from employment and medical appointments based on urgency, like dialysis. My proposed intervention is twofold. A small-scale, one-time pilot project that includes all Springfield Metro Area transportation choices on a brochure and poster format, and it could be the answer to raising awareness about transportation among those who have a disability and need transportation. The poster would be all-inclusive with captions on where each transportation service is available and how to access the service. The second step needs to start with assessing if the poster awareness campaign is working and if there is an increased awareness of the already available resources, which would be Oats Transit and Ability Transportation. This can be determined by recognizing an uptake of riders to the Ability Transportation and Oats Transit. If individuals with disabilities are still reporting the lack of transportation or lack of more versatile transportation systems, then the second step would be to advocate for a policy change at the state level. This can be done by advocating for money for a voucher program. For example, the state of Michigan has implemented a program where individuals with disabilities receive a certain amount of miles per year in the form of a voucher book to pay either public transportation, a ride share, or a family and friend to take them where they need to go. This gives the individual independence and a choice on when and where they decide to travel. It also contributes to the overall community by having more individuals employed and a better quality of life for the riders. But until awareness about Oats Transit and Ability Transportation is available, we cannot predict what exactly is needed with the voucher program. So this is a very rough example of the poster project that I propose. Each transportation provider will be listed with their logo, service area, and easy to understand details. It would be in the form of a poster or a brochure, or both, displayed on the walls of service providers, employers, and disability advocacy locations. The poster project will directly impact persons with disabilities, their family members, the local community, and employers seeking more team members to grow their business. It also will benefit the community economically by allowing non-drivers to contribute to the local economy in Springfield, Missouri. And actually, I already have permission from Vocational Rehabilitation to put it in their new Springfield South office. The desired outcome for this project and the way we can evaluate if it is working would be that 90% of service providers and Department of Mental Health providers would agree to display the poster when approached. Also, 75% of those case managers would hand out the transportation brochure at their client's annual review. Lastly, within 6 months of the poster and brochure being circulated, there would be a 20% uptake of Oats and Ability Transport clients calling. The social justice implication is that access to transportation enables those with a disability to work, visit their friends and family, and participate in various activities, which helps them lead a more fulfilling life. The ultimate goal is to build an inclusive community where everyone has a voice and a part. In summary, Springfield Metro Area is lacking transportation for those with disabilities. There also is no cohesion or central goal to provide a service. They are individually single-focused on their own goals. A poster project with all transportation providers will create a focused informational service for those with disabilities to find a ride and be active in their community. In the long term, more funding for transportation is needed, and this may or may not include a voucher program, and funding for mass transit. In conclusion, advocating for transportation for everyone creates advantages for all. Inclusivity is good for everyone.